Hey guys, Dr. Scott here again. As you see from my postings, I'm calling all these videos, especially the ones I'm doing here at the office, kind of keeping it real. I guess it's just a way of saying I really try to talk to you. I know I'm talking a lot of different. I'm talking to some professionals are watching these videos. They probably agree on some things, maybe not agree as much on others. And also lay public, I got probably students, so I'm trying to speak it more on a casual basis. I will go into some technical things at times. Sometimes it's just, I try to keep it more of a coffee talk. Today I want to talk about Google and the Google education people get, that drives practitioners mad, as well as understanding that not everyone's back pain. I'm going to be talking more about back pain today. Or it could be any joint, isn't the same from one person to the next, Let me give you a scenario. You have a problem with your back, all right? And you start Googling, you get on these forum boards, Your back pain, may be different, maybe emanating from other things other than Joe Schmo that lives in Arkansas or California. And what are they doing? They're telling you, hey, I had this problem too, and I had this treatment, and that worked for me, or you're Googling the symptoms, and as great as it is, and as a practitioner, even though I make kind of fun of the Google degrees, it's great having patients that are more educated about these things than they were maybe 20 years ago, because they understand things a little bit more, But again, then you get into a problem because you think your back pain or you have pain going down your leg, it's always one issue. And you think, oh, well, if that's the issue, I should get epidurals or I should get facet blocks or, everything, I don't know when to see a chiropractor, physical therapist, should I see both? Or, you always get this crazy information. You could be sitting at a barbecue with Uncle Joe or a Thanksgiving dinner and they're like, yeah, I got back pain, leg pain. It was a nerve issue and just had to get epidurals and you were fine. And I'm not slamming epidurals and surgery or really anything, but I definitely feel those should be, more aggressive options versus say chiropractic, physical therapy, massage. However, I just want you to understand that when they do tell you that, just because you have a symptom that's similar, you shouldn't just rush into those more aggressive forms of therapy. Now, backing up for a second, when I talk about not everyone's back pain or leg pain is the same. I'm going to bring up my little spine here just for a quick example. This is your back, as if you're facing that direction, These are the little bumps on your back that you feel spinous processes. Well, we have back pain, all right? And sometimes we'll have back pain with buttock pain or, you'll think of leg pain or you'll use the term sciatic pain, all right? There's so many structures in your back that can cause back pain, all right? If you can see, there's these little discs, all right, that sit between each vertebrae. The vertebrae are like the little blocks. The discs are like little jelly donut shock absorbers. There actually is a more water-based material, nuclear material in the middle, and there's a harder material on the outside. I won't go into technical terms, but it's nucleus pulposus annulus fibrosus if you are Googling it, all right? And the disc can, migrate. That can emanate pain. It can bulge. It can herniate. Maybe another video I'll talk about the difference between a bulge and a herniation. It can hit nerves, so you can get disc pain. It can hit the nerves, or these yellow things that are coming out that supply in the back. They supply everything in the buttock, down the leg. In the neck, they're going to supply everything down into the arm and down to the fingers. So we know when you go to chiropractic school, medical school, physical therapy, whatever medical athletic training, certain nerves can give different symptoms, So yes, disc pain can cause just local back pain. Disc pain can also hit the nerve, cause you back pain and leg pain. We also have the facets, which are these little areas where the motion, a lot of the motion occurs in the spine. Think of like a door hinge, They don't work exactly like that, but just understand that's where the movement is, especially the lay public here. So as we're flexing and extending the spine, those joints can get irritated. They typically will give you more local pain, but they can also refer pain and feel like it refers pain down into the buttock. And when I talk about referred pain, make sure you guys understand, you've always heard that person, they have a heart attack, They may have, God forbid, they have pain radiating down their left arm. They don't have a left arm problem, right? They have a heart problem, but they can get referred pain down their arm. This, when I say referred pain in the back, is a similar thing. You have a problem in one place, but it refers pain elsewhere. Other things, sacroiliac joint, where your sacrum meets your pelvis. Okay, you may feel those in your buttock area, upper buttock area. That can be a source of pain. All right, when your pelvis rocks and you walk or you're running. Okay, I'm going to turn it this way. Okay, there can be some irritation there. The other thing I'm missing is you have back muscles. Okay, that run up and down the spine. Sometimes they go on an angle. Those can get damaged. They can cause back pain. All right. Lower in the pelvis, you may have heard of the sciatic nerve. All right, it's formed by nerves in your low back that come down from the sciatic nerve that passes through a notch here, and there's a muscle called the piriformis. Okay, it's a muscle that laterally rotates, almost like if you go into a Indian-style position, a figure 4 position with your hip. Okay, that's lateral rotation of the hip. That can squeeze the nerve. So the reason why I'm bringing this is not to give you an anatomy lesson, is to understand that whether you are in a sports injury, the pain just gradually came on, whether you were in a car accident and you get back pain, it can come from a lot of different structures. Okay, it can come from the joints, it can come from the disc, it can come from the nerve, the muscles, it can come from one or all of those conditions. Okay, so now once a doctor, and to be honest with you, when you go in the first day you see your doctor and they don't know you, and you come in, I got back pain on the right side, it goes into my upper buttock area. They may not be able to slam their fist down and say, hey, it's definitely a disc issue. They're probably going to say, hey, look, what happened? Oh, you fell. You probably strained the muscle. The joint may have gotten a little irritated. We got to keep an eye on the discs and the nerve, because if you don't improve with some therapy, we may have to do MRIs and things like that. Okay. So again, so your problem, you could fall and slip on ice and just strain the muscles in your back. Okay, and you come into my office or anyone's office and they palpate and they say, look, you have a muscle strain. All right, so this is what your treatment's going to be. Maybe some stim, heat, muscle work, some exercises, stretching. Okay, you could have someone else that fell on ice the same way. All right, their symptoms are back pain going down the right side, just like you. Okay, maybe they have other symptoms, maybe tingling in the toes, but they don't have to have that. It could be, and they may have a herniated disc, okay, pressing on the nerve in the back, giving them back pain, leg pain. So their treatment would be completely different, all right? So you really, when you go on Google and you do the research, or you already armed yourself with something in your head when you see your doctor, okay, whether it's a doctor or PT, chiro, again, and when I say that, and I'm saying health, I'm trying to speak for a lot of different health professionals, whether they like it or not, but there is some similarities and overlap with what we do. And I actually had one reach out to me that even though he's a PT, we see the same types of things happen all the time. So he can kind of relate a little bit to my videos, that your treatment plan could be completely different. So what I suggest is, if you have a problem that's extremely mild, if it's not going away, call your doctor up, go in there, go with an open mind. Okay, don't go armed with a million things on Google. I read this surgery, and I heard discs don't go back, the way they are in each surgery. Just open-minded. Uncle Joe tells you at Thanksgiving, you have to have this. Just go in, have some confidence in your provider. All right, let them evaluate you. Don't expect them to have everything answered for you day one. All right. Maybe start a conservative treatment plan and see. Now, they'll know that if something's not working, that maybe you do need things more aggressive. I have patients that get epidurals and facet blocks or whatever, but the main reason for this video is to understand that back pain, and I'm speaking about back pain, but it could be neck pain, shoulder pain. There's a lot of different structures in all these anatomical areas. Knee pain, ankle pain, getting ligaments, muscles, joints, okay? And not everyone's treatment is going to be exactly the same. And while I'm on that topic, a lot of times, people will have, the sexy diagnosis is that they go to the MRI and they have a herniated disc, okay? And they'll come in day one. I got my MRI, I got a herniated disc. And we find out, they'll be evaluated, whether it's the neck or the low back, a herniated disc, that their symptoms are more muscle related. Okay, so this is just an example that, and they actually have done research this way. They take 100 people off the street with no neck or back pain, put them in an MRI unit, and they have a herniated disc. okay? You can take people with pain, do an MRI, and they have no herniated disc. So it's a valuable tool. Okay, the MRI is one of the golden standards to evaluate things like that, but understand just because you have one or you have an MRI, that when you come in day one and you're with your different therapist or whatever doctor or whatever they are, and they treat these type of problems, that they'll try to ascertain where the pain is coming from to the best of their ability. But you can see on the few of the things I just mentioned on my model spine here, it can come from different things. So just keep an open mind, even if you do your Google search, all right? But if you have an open mind when you see your provider, that after they evaluate you, they'll go down the course. But again, just the medical legal thing, if you're watching this video, don't diagnose yourself. I'm telling you not to do it on Google. Don't do it with my videos, all right? Let someone evaluate you, okay? So again, thanks for listening, and you'll see me soon. Take care.